Gregory J. Daniels DDS and his team provide cosmetic and general dentistry services to patients in the western suburbs of Chicago. Throughout his career, Gregory J. Daniels DDS has been at the cutting edge of cosmetic dentistry practices in an effort to offer his patients superior outcomes. Adding to his already impressive repertoire of services, Gregory J. Daniels DDS recently completed training for the use of Botox in dentistry. In the following Q&A, Gregory J. Daniels DDS discusses the dental use of Botox and the training he undertook to bring this service to his patients. Q. What is Botox? Gregory J. Daniels, DDS. Botox, clinically known as botulinum toxin, is a protein and neurotoxin that has been used successfully for cosmetic procedures for more than 20 years. Q. How does Botox work? Gregory J. Daniels, DDS. Botox inactivates muscle fibers by interfering with the transmission of the nerve signal which tells a muscle when to contract. After 3 to 6 months, the mechanism regenerates or heals itself. Changes are not permanent. Q. How is Botox administered? Gregory J. Daniels, DDS. Botox is injected in tiny quantities to the body of designated muscles with an insulin syringe. Mastery of the anatomy of the muscles of facial expression is key to competence in this treatment. As a dentist, I have always dealt with these structures and am familiar and comfortable with the anatomy of these structures. Of course, as a dentist for all these years, giving injections is part of nearly every procedure. Q. How do you decide where and when to use it? Gregory J. Daniels, DDS. As we age, the elasticity of our skin diminishes. Our muscles of facial expression have been programmed for many years to act in the same way repeatedly. These muscles are so accustomed to being in a contracted state that there is always some degree of tension within them. Wrinkles develop in lines perpendicular to the direction in which the underlying muscle fibers pull. Prior to administering of any medication, the face is mapped. Objectionable wrinkles are noted and the underlying muscles are identified and marked. Botox is injected into the muscle, or area of focus with a tiny needle. Within 3 to 7 days, a noticeable smoothing of the wrinkled skin occurs. Q. Is Botox used for more than cosmetic purposes in dentistry? Gregory J. Daniels, DDS. Research is ongoing in the treatment of migraine headache and myofascial pain. In these instances and in the treatment of TMJ pain, Botox can be injected into painful muscles to alleviate spasm. Gregory J. Daniels, DDS. Yes, with proper training. Currently, about half of the states in the U.S. allow dentists to administer Botox, which includes Illinois. Q. Where did you complete training for the use of Botox in dentistry? Gregory J. Daniels, DDS. The Aesthetic Skin Institute presented the training here in Chicago. Q. What did Botox training involve? Gregory J. Daniels, DDS. The Botox and dermal fillers training prepared me to diagnose, integrate into treatment, dose and deliver, and avoid and treat any adverse reactions to these treatments. Q. What are the risks in using Botox? Gregory J. Daniels, DDS. As with any type of dental or medical procedures, there are risks. Each patient should talk with his or her dentist about potential risks before including Botox in a treatment plan. Q. Where can people learn more about Botox for use in dentistry? Gregory J. Daniels, DDS. Anyone can contact my office directly or go online to installdentist.com.